Dr. Martha Whyte, Medical Director, State Office of Public Health for our region. Hey, Dr. Martha, welcome back to Keel. Thank you for taking time. So
How
Aaron's freaking out again, and
don't know.
I know that
Oh,
you
you're
by trade
echoing.
are a physician, by trade a pediatrician, and that psychiatric care of a 50-something-year-old woman usually is not in your purview, but anything you can do to calm her down would be greatly appreciated.
Well, it's one case, right?
Right.
We knew there are cases here that we were just waiting to test the right people. Again, most of us are just going to get a bad cold, mild flu. The biggest thing that we want to make sure is if we get sick, that we stay home. We want to try to prevent us from getting sick, and by, doing all those hygiene things that we talk about, keeping your hands off your face, washing your hands a lot, staying away from big crowds if possible. But there's no reason to panic or, run and pack up all the toilet paper that you can.
I had mentioned on the radio earlier this morning, in fact, a couple of times, there's a Joe Rogan podcast video clip that's going around Facebook, social media, and he's talking to an infectious disease expert. And everybody is commenting, this man's very insightful. He's so wise. He's so smart. And I said, wait a second. The very first thing he says is wrong, because the very first thing he says is, this is an airborne virus. Explain to everybody how it is not, but on the other hand, how it can be transmitted.
Right. So the difference between airborne and droplet, two different things. So airborne means that when you cough it out, it stays in the air. It's really tiny particles, and so it'll stay in the air for a long time. And more people are likely to walk through it, breathe it in, get sick from it. Droplets are heavier particles, and so when you cough or sneeze, it falls to the ground right away. So it's only kind of in your little immediate area, which is why we say if you stay a good 3 to 6 feet from somebody, you're not going to get this from them coughing and sneezing. Now, the way you're going to get it is them coughing and sneezing on a surface, and you come and touch it, or say they wipe their nose, they use a Kleenex but don't wash their hands, and then they touch something and you touch it behind them. The only way you can get it that way is if you take your dirty hands and you put it on your face. We all touch our face a lot.
Martha,
it's hard to remember not to, but if you can remember not to, it'll go a long way to protect you.
Doc, the local case you told me last night, a man in his 60s, you can't tell me much more about it. My concern about that is, why can't more information be given out about where he was? Was he at big events where there were, lots of other people, so that you could ease the concerns of some of us? Because like today, I don't know if this man and I have ever crossed paths.
Sure. I understand. So let's realize that it's not just walking around him. Not very likely to get it from him. Like I said, you're not, unless you just happen to sneeze. He sneezes on you. But we are working all of his contacts. So that's something public health does a lot year-round for outbreaks of all different kinds of things. So we find out where he was, who he was around, who they were around. So we'll do that contact investigation, and we'll let you know. The reason why we don't give a lot of information out, and sometimes the person will come out themselves and say, hey, it was me, or sometimes they'll say it's okay to let information out, but it's to respect his privacy. And so people aren't kind of ostracizing a person. Mm-hmm. What we need to understand is people get mistreated sometimes when people are afraid. And so we just want to protect this person's privacy. We're going to make sure that if you are around him, that we talk to you. Okay?
Gotcha.
So if we find he was at a big event, we'll let the people at the big event, we'll let the public know, hey, we need to talk to you if you were at this event.
Any idea on where he may have contracted it? Is that hard to tell?
That's really hard to tell, but we're going to work on it and see if we can find that out. But being that he's our first in this area, unless we can connect him to other people, may be hard to find out, but we're going to definitely investigate it.
If someone may have woken up today with a little cough, should they worry?
Well, what you have to understand is what's common is common. And right now what's common is a cold, is allergies, and is the flu. So you're most likely to have one of those. The other possibility is that you could have coronavirus, but we're going to rule everything else out first before we worry about that. So, no, I wouldn't worry.
Okay. We have a Houghton couple. They feel kind of stranded in Europe right now. They have a flight back on Tuesday, flying from Paris to DFW. Health-wise, can you give us some guidance on what will happen to them if they land at DFW and test negative? Will they still have to be held there for 2 weeks? Could my question is, could the test come back positive 2 days later or 3 days later? You follow me?
I do. So, unless I've missed something this morning, Aaron, I'm not sure that they're doing federal quarantine yet. Now, I know that Trump, is stopping travel into the States. But what we would do and what has been being done is if they don't have symptoms, they come home, and we ask them to self-isolate at home. Most people are very understanding and realize what that means and how important it is. Every once in a while, you're going to have someone who doesn't listen and goes, I think there was a story in the news about a man who went to a father-daughter dance with it. Mm-hmm. So we can't guarantee that they won't go out. But the good news is if they don't have symptoms and they go out, they're not very likely to transmit it to anybody. So, but we still really ask them to stay home and let other people do for them.
Okay.
And that would be for 14 days. Now, if they got symptoms, it would be until they were 24 hours fever-free.
Okay. Gotcha.
Are you feeling a little bit better down there?
I'm feeling a little bit better, but I know she's going to tell me there are other cases here. We have one. There are probably others, correct?
Yes.
Yes. Why did you say that so quickly? Because you could have hesitated a little bit.
Sorry, Dr. Whyte. She's making me nuts, and I apologize. It's her degree of alarm is.
I'm worried Tom Hanks needs to pick out a casket.
Exactly. Tom's going to be okay.
Yeah.
You're going to be okay.
Tom's going to be okay.
Everybody's going to. 1, 2, 3, Dr. Whyte. 1, 2, 3. It's going to be okay.
Yeah.
Okay. It's all going to be okay.
All right. Okay.
We do need to keep everybody calm and realize just be smart. You know what to do. We've been telling you for years how to protect yourself from the flu. So as long as you stay calm and you follow those rules, you'll be okay.